Welcome to The Explainer. Today, we're diving into something huge, a brand new set of rules that could literally change the outcome for a baby in the most critical moments of their life. We're talking about the 9th edition of the Neonatal Resuscitation Program.
Let's just let that sink in for a second. This quote really gets to the heart of why these new guidelines are so incredibly important. You know, most babies come into the world just fine, but that day of birth, it's their most vulnerable moment. And that's why having the absolute best, most up-to-date science right there at the bedside, well, it can make all the difference.
So you gotta understand, these updates don't just happen overnight. They're not decided on a whim. This is the result of a massive 5-year global effort. It all kicks off with ILCOR, which is this international group of experts who dig through all the science. Then that evidence gets turned into actual guidelines here in the US and Canada. And finally, it all gets packaged into the NRP textbook and the training that doctors and nurses use every single day. All right, so here's how we're going to tackle this. First, we'll look at the global effort. Then we'll get into what's called the golden 60 seconds. After that, it's all about the breath of life, then some of the new tools and really tough calls, and finally, we'll see how this is all expanding beyond the delivery room.
Okay, let's jump right in. Section 1, a global effort. We're going to look at how the world's experts are working together to really refine neonatal care.
So one of the biggest new ideas in the 9th edition is this concept of the neonatal chain of care. And honestly, this is a huge shift in thinking. It basically says, hey, resuscitation isn't this one-off event. It's actually a link in a much longer chain that starts before birth with good prenatal care and continues after the resuscitation. And what's the central link holding that entire chain together? You're going to hear this a lot: effective ventilation.
All right, moving on to Section 2, the golden 60 seconds. This is all about redefining that very first minute of life. And let me tell you, the changes here are a really big deal.
Okay, this right here is one of the most significant changes, a real game changer. The old guideline was to wait at least 30 seconds to clamp the cord. Now, they've doubled it. We're talking at least 60 seconds. And this isn't some side note or a nice-to-have anymore. It is now a core part of the official resuscitation algorithm. Why? Because the science backing it up is just overwhelming. So why does this 1 minute matter so much? What's happening? Well, in that short time, the baby gets this incredible, vital transfusion of blood from the placenta. It's almost like nature's own booster shot. It jacks up their blood volume, gives them iron stores that can last for months, helps their whole cardiovascular system adapt, and, this is huge for preemies, it significantly cuts the risk of brain bleeds.
But okay, what happens when waiting a full minute just isn't possible? For the first time, the guidelines give clear advice on something called cord milking. Now, for term and late preterm babies who aren't vigorous, it might be a reasonable option, but, and this is a big but, for the tiniest babies, those under 28 weeks, the recommendation is a hard no. The risk is just too high.
All right, Section 3, the breath of life. This is where we get to the absolute cornerstone of neonatal resuscitation, ventilation. Seriously, if the clinical team gets this part right, almost everything else tends to fall into place. And here's where you can really see how all these changes connect. Remember that extra minute for cord clamping? Well, because of that, the old 1-minute oxygen goal doesn't really make sense anymore, right? So they've completely updated the target table. The clock now starts at 2 minutes, which just aligns so much better with what's actually happening with the baby's body. They've also tweaked the specifics of how to ventilate. The breathing rate now has a wider, more flexible range. The starting oxygen level isn't one size fits all anymore. It's tailored based on the baby's gestational age. And that old practice of routine suctioning? Gone. The evidence is clear it can actually cause problems, so now it's only done if the airway is actually obstructed.
I love this next part because it really shows the new philosophy in action. Everyone in the field knows the MRS SOPA mnemonic. It used to be taught as this rigid step-by-step checklist. You do M, then R, then S. Not anymore. Now it's presented as a toolkit. It empowers the team to think critically, figure out what the actual problem is, and grab the right tool for that specific job instead of just going down a list. It's so much smarter.
Okay, Section 4, tools and tough calls. Now we're getting into the more advanced stuff, and also how this new evidence is shaping some of the most difficult ethical decisions a team can face. When you have to intubate a newborn, the size of that tube is absolutely critical. Too big or too small, and you've got big problems. So the new guidelines have refined the sizing chart, adding a whole new category for the absolute tiniest babies, those under 800 grams.
It might look like a small detail on a chart, but for those incredibly fragile infants, it means a much safer, more precise procedure.
And all this talk of precision leads to a really important question, right? Can new technology actually help us do these critical procedures even better?
Well, the answer is a resounding yes. A big meta-analysis looked at using video laryngoscopy, which is basically a tiny camera on the end of the blade to see what you're doing, and the results were clear. It significantly boosts the success rate of getting the tube in on the very first try, which is crucial, and it reduces injury to the airway. It's a perfect example of science directly shaping the tools we use.
And this is so important. The guidelines now offer a clear ethical framework for those impossible situations. The first principle, when in doubt, you start resuscitation. You can always reassess later. They also provide a time frame suggesting that after about 20 minutes of continuous CPR without a response, it's reasonable to start talking about changing the goals of care. And woven through all of it is this constant reminder the parents' wishes and views must be supported.
Okay, our final section, Beyond the Delivery Room. And this is a huge step forward, because the 9th edition finally acknowledges a really simple but critical fact. Babies can need resuscitation long after they've left the delivery room.
So to address this, they're rolling out 3 brand new educational modules. There's one specifically for babies with critical heart disease. Another one is designed for the unique challenges of resuscitating older infants in the NICU. And a third is for EMS and other pre-hospital teams. It's all about taking these core life-saving principles and applying them wherever a baby might need help.
So, when you step back and look at the whole picture, what's the big takeaway? The 9th edition is all about making care more physiologic, meaning more in line with the baby's natural processes. It's about being more flexible, trusting clinicians' judgment, and it's about having a much wider scope, reaching more babies in more places.
Ultimately, it all comes down to this one idea, one unified approach. The whole point of this massive, global effort is to create a single, evidence-based standard of care so that every newborn, everywhere, gets the absolute best possible start.
So, to sum it all up, what are the key themes? It's about refining everything based on the best science, giving clinicians more flexibility, and expanding the scope of care. It's that simple.
And that leaves us with one final thought to chew on. We've seen how these guidelines are making resuscitation more evidence-based, more tailored to each individual baby than ever before. So what's next? What's the next frontier? As the science keeps pushing forward, what's the next big breakthrough going to be in this mission to save our tiniest patients?